Hi everyone, welcome to Ra Online. So this is Dr. Ashok, consultant clinical microbiologist. So today we are going to learn about one of the most common parasitic infection which is going to involve the respiratory tract, and this particular parasite is going to come under the classification of trematode. So whenever we are going to study about a particular parasite, we have something called protozoa and helminth. And again the particular helminth can be classified into cystode, trematode and nematode. So this particular Paragonimus will come under the trematode. So let us see a case following which we can learn about the theoretical aspect. On the end of the particular PowerPoint, I have an examination point of view in nutshell. So we will see that particular nutshell also. So let us go into the topic now. So we have a case here. So here we are seeing a 32-year-old male from Manipur developed acute onset hemoptysis associated with chest pain. And clinical examination are suggestive of bronchitis. And the doctor notices multiple cases of hemoptysis in the past days in the particular place of Manipur. And the specimen was subjected to wet mount examination, which showed the following finding. What is the diagnosis? So here you are going to see a case of hemoptysis where there is going to be a presence of blood in the sputum. So here the patient have developed blood in the sputum, that's called as hemoptysis, and it's a state of Manipur, and the specimen subjected to wet mount examination showed the following finding. So here you are going to see the particular egg, so which is going to be an operculated egg. So here there's going to be egg and there's going to be an operculum. So that is going to be a lid-like structure. So that is going to be the operculated egg. So whenever we are going to see a particular operculated egg in the sputum, it is highly suggestive of one particular infection called as Paragonimus westermanni. So it is going to be a trematode. So the particular adult worm is going to give rise to the particular egg, which is going to be the operculated egg, and the particular operculated egg is going to get excreted in the sputum. Sometimes the pediatric age group can swallow it, which can end up in the particular egg being released in this patient's stool specimen. So this is how the particular egg is going to look. So here there is going to be in presence of operculated egg. So it's a case of Paragonimus westermanni, which is going to cause a particular condition called as endemic hemoptysis. Okay, so we will go into the theoretical aspect now. So it is caused by a particular parasite which comes under the trematode called Paragonimus westermanni. So as I told, whenever we are going to study about a particular parasite, we need to know the classification. So the particular parasite can be classified into a protozoa and helminth. Again, the particular helminth is going to get classified into trematode, cystode and nematode. So this particular Paragonimus westermanni comes under the trematode. So it is going to be one of the most common trematode which is going to involve the respiratory system, that is the lung. And the particular adult worm is going to lay egg, and the particular egg is going to get ended up in we will find out the particular egg in the sputum of the particular patient. In case if it is going to be pediatric age group or children, they are going to swallow the sputum specimen and the particular egg is going to be excreted in the stool specimen. And this is called as oriental lung fluke, and it's going to cause a condition known as endemic hemoptysis in human. And this particular infection is going to be very much endemic in northeast states of India, and more cases have been reported from states like Manipur. So this particular infection is more common in states like Manipur. So whenever we are going to work in the particular state of Manipur, whenever we are going to see a lot of cases of hemoptysis, we must have an idea about this particular infection. And this particular infection can mimic a lot of other things like chronic bronchitis or bronchiectasis and even pulmonary tuberculosis. So we must rule out this particular condition so that the particular treatment is going to be more simple. In case if it is going to be TB, the patient has to take antibiotics for around 6 months. So we must not miss out the diagnosis, and it's more common, we may miss out the diagnosis in case if the particular etiology is not proper. Okay.